The thing is that the mitochondria make NADPH by the breakdown of glucose. The NADPH, the mitochondria reduce the NADP back to NADPH, that reduces FAD to FADH2, that reduces oxidized glutathione to glutathione, that reduces dehydroascorbate to ascorbate, and this goes on and reduces oxidized vitamin E back to vitamin E. Now, also, this NADPH is the fuel for the respiratory burst, the phagocytosis of the white cells. Paradoxically, the energy with which the body makes these oxidizing substances is reducing power. NADPH is a reducing substance, and it reduces molecular oxygen to superoxide, which joins with water to form peroxide, which joins with chlorine to make hypochlorous acid, and so then those substances go off and kill the bacteria. Now, I call those radicals because they're inside the vacuole of the white cell, and they're doing what they ought to do, that is, kill the virus, bacteria, parasites, or whatever. And I only define them as a free radical when they leak out onto the adjacent tissue and start causing trouble, specifically when they start damaging mitochondria. And I think this is where most of the free radicals of diseases come from. In the mitochondria, there's some very dynamic metabolic processes going on. The glycolysis and the citric acid cycle are involving processes, enzymatic processes that involve a lot of exchanges of electrons, and when you damage the mitochondrial membrane, then you interrupt some of these processes in their mid-cycle, and this liberates free radicals, which then go off and damage other mitochondria, and at that point we get a cascading effect. This cascading effect is usually prevented by the free radical scavengers in the cytoplasm of the cell, but if the free radicals are too much, it destroys all these free radical scavengers so that the white cell or the cells of the body can't defend their mitochondria anymore. So we have the situation where the mitochondria has to make the reducing equivalents to defend the mitochondria themselves from the free radicals. And when this goes down the tubes, then the person then there's a cascade, this free radical cascade, inflammatory cascade within the cells. And so the purpose behind the massive doses of ascorbate is to neutralize that cascade. Now, one of my theories about this is, one of my great interests in ascorbate was that when I took ascorbate, it blocked my allergies. That was one of the things that made me pursue this thing. And I had seasonal hay fever, and when I started this off, it took about 16 grams a day to block my hay fever. I wonder, how can this be? And this is a rather sudden effect if a person is a really good ascorbate taker. I have had a real runny, stuffy nose and taken a massive doses of ascorbate, and in 5 minutes had it clear. Well, again, when I say ascorbate, remember ascorbic acid is hydrogen ascorbate. And so just my way of saying is that when I'm using it in massive amounts for the electrons, I call it ascorbate. When I'm using it as a vitamin, I call it vitamin C. So that when I say ascorbate orally, I mean ascorbic acid. And so anyway, I take these massive amounts, and it would block the hay fever, and I wonder, what is going on here? Well, then I became aware of this fact that very little is made of this, but there's a book by Sherry Lewin entitled Vitamin C, Its Molecular Biology and Medical Potential. Unfortunately, it's out of print. But he raises the hypothesis that ascorbate in massive amounts can reduce disulfide bonds to sulfhydryls. So that here, this is just a schematic of a typical antibody, and you'll notice that whenever you see pictures of receptor sites of various different elements of the immune system, they always seem to have these little disulfide bonds right here. And nobody seems to ever make anything out of that. There are, by the way, interchain here disulfide bonds, but they're sort of deep within the molecule. There's some thought that this receptor site up here, that this whole area is under a little bit of stress, so that disulfide bond is more easily broken by a reducing redox potential than the other disulfide bonds. Anyway, there's a paper that describes this, that that the affinity of antibodies for their antigen is greater in an oxidative redox potential than it is in a reducing redox potential. So I think that in the normal state, that there is a breakup of this bond and the antigen binding site is inactive. This is just a theory, but something like this happens so that the immune system is not as responsive to things when there is a reducing redox potential. This is sort of neat because you don't want your immune system going off after things when you're perfectly well. I mean, the food that you eat is a foreign body, but you don't want your antibodies to those foods multiplying and attacking the food or cross-reacting with organs of the body. So that I think that the way the body can tell the difference between a good foreign body and a bad foreign body is that the good foreign body is not provoking free radicals, whereas the bad foreign body, like a virus, is, and the free radicals then turn on the immune system. I think this is the hidden... Is that means what? Oh, anyway, this is this unknown signal that signals the immune system to get active. Now, this is one of the big problems. That where this goes wrong is when you're chronically ill with something like candidiasis or EBV or herpes 6 or cell wall deficient bacteria, progenitor, cryptocytes, whatever, that this chronically upregulates the immune system so that now the immune system starts to react to good foreign bodies. It gets confused and makes antibodies to foods and chemicals that ordinarily we shouldn't be allergic to, and that then they cross-react with organs of the body and cause various different diseases. So anyway, I think this is one of the mechanisms, or the mechanism behind it. Anyway, it's the rationale for the modus operandi of my practice and my reason for trying to eliminate all the free radicals. Now, when I first went up to Incline, they were in the midst of a beta hemolytic strep epidemic, and there was no question about this. We could culture group A strep out of everybody that came in with a sore throat. And so I was giving penicillin, but giving ascorbate at the same time. And I went through about 300 patients and had no allergic reactions to penicillin. Well, the published rate, well, of course, I asked them if they were allergic to penicillin, and I didn't give it to people who said they were, but the published rate is about 3%. So I should have had about 9 patients by that time having a rash, and I didn't have a single one. Well, one weekend, this fellow came in who had gotten his penicillin elsewhere, and he had the typical urticarial rash. Well, I seized the opportunity and gave him an intravenous push of sodium ascorbate, and within 15 minutes the rash disappeared. It was a 50 cc syringe, wait a minute, 1 gram, about 25% solution, so it's about 12.5 grams. And it just vanished. But the point is that, see, that I think what it did was to dismember the antibodies that were causing the reaction, and poof, the reaction was gone. And I gave him a prescription for Benadryl, and the next day I saw the patient, and I also told him to keep taking ascorbic acid. The next day, the patient sort of gently chewed me out for having spent his money on Benadryl, because he said the rash never came back. He just took the ascorbate. And, pardon me? No, he stopped the penicillin. But there's, going back, oops. Now, you'll notice that world's champ here at burning up ascorbate is mononucleosis. Now, you know, it's published that if you accidentally give penicillin to a mononucleosis patient, that about 50% will break with a rash, and virtually 100% will break with a rash if you give them ampicillin. So 2 and 2 starts making 4 rather than the usual 22 for physicians. And and so I began to think, hey, all this evidence is that that there's something here about ascorbate that really blocks allergic reactions. It's like I asked one of the professors of immunology at Stanford a few years ago. It said, has anybody ever suggested to you that the reason why people have so many allergic reactions to drugs like penicillin is that they take them when they're sick? He said, no, no one's ever suggested that. Well, I mean, it's so obvious. And I think those of us who really take extensive histories and see these chronically ill patients can almost always trace their chronic illness, their food and chemical sensitivities, back to some period of disease or stress or some massive exposure to chemicals or something, that there's some explanation that the immune system has either been upregulated by some toxic product or due to some nutritional deficit that the free radical scavenging system has been weakened, or due to stress. You know, I kiddingly say we physicians have this educated inability to comprehend the simple concept that you need more nutrients when you're sick or under stress than you do when you're perfectly well. And this is why I think that illness and stress induces nutritional deficits that have nothing to do with the RDA and causes a lot of deficits which cause malfunctions of the immune and the free radical scavenging system, which then upregulates the immune system and allows all these food and chemical sensitivities to result. I think anything that damages the mitochondria so that the mitochondria can't keep up making enough reducing equivalents to fuel the free radical scavenging system causes chronic fatigue. After all, the mitochondria have to make ATP, and if you don't make ATP, you get tired. You know, we don't have a gas gauge that goes on empty. We get tired. And I think this is why when we get ill that we just universally get tired, and that's a sign of the mitochondrial damage, not producing enough ATP. So anything that does that is going to cause fatigue. I think the people of the chronic fatigue people are looking for the cause of chronic fatigue, and I don't think there is a single cause that multiple insults to the body will cause chronic fatigue, so it's different in different people. Now, I also treat, by the way, so the ascorbate does not cure allergies. It simply ameliorates or eliminates the symptoms while you're saturated. All of us who take ascorbate have this love-hate relationship with the darn stuff, but we're really hooked on it. And I would say that after several years, you're going to have to take half again as much to accomplish the same result that you did in the first place. So there's a little bit of tachyphylaxis, but it's not bad. I figure that after 20 years of this, I'm taking about twice as much as I did in the first place to accomplish the same thing. But anyway, the thing is that I think that the amount of ascorbate that the person with the strong stomach can take is sort of proportional to the gremlins that they have in their body. And what I mean by that is the indwelling viral bacteria, fungus, parasite, cell wall deficient bacteria, and so forth, that are loading the body, they're damaging the body and forming free radicals, and that the bowel tolerance is increased by this process. I'm very worried about the younger generations with sexual promiscuity and the increased traveling and the increased world population, that I think the gremlin load of the younger generation is increasing. And while they're young, they can tolerate this, but I would hate to think what's going to happen when this generation gets to be 60, 70 years old. I think we're going to see more and more troubles unless people like you out there learn how to kill off these various gremlins and rid their body of things like EBV and herpes 6 and so forth forever. Then the tolerance to ascorbate will go down. Now, the trouble patients. People who develop food and chemical sensitivities, it's sort of like, this doesn't hurt, but if I had a sunburn, it would. And so if you have a previously existing gastritis or ulcer or something or other like that, the ascorbate may hurt because of the topical application. Now, if the person can stand it, and it takes high doses of ascorbate, very likely it will heal the ulcer. I would say that about half of my ulcer patients claim that the ascorbic acid cures their ulcers, and about half the patients chicken out. Now, you know, you can also cure a certain percentage of ulcers with cayenne pepper. Be good luck, but that's a sort of extreme example. I suppose the Helicobacter doesn't like cayenne pepper, but boy, it may hurt. I think things like cabbage juice probably don't bother things. So anyway, then there is this increased peristalsis that people have various different GI tract difficulties, and the ascorbate will irritate, and there are some people who have previously existing GI tract difficulties who will get diarrhea very rapidly and get so much diarrhea that they really can't achieve this ascorbate effect here. You see, if you've got this problem and you start getting diarrhea for miscellaneous reasons back here, you're certainly not going to be able to take a therapeutic dose of ascorbic acid by mouth. In those cases, sometimes I'll use intravenous. Now, for instance, a case where there'd be no question that I would use intravenous ascorbic acid or sodium ascorbate is like a 70-year-old who comes in with viral pneumonia, and I want to get about 200 grams into them. Well, there's no way he's going to be able to take that by mouth, and so we hook him up to intravenous, and then it's probably going to only take about 60 to 120 grams intravenously to have the same effect. And so we do use intravenous ascorbate for acute self-limiting viral diseases. I'm very reluctant to use it in AIDS patients for political reasons. This is a big problem, and it weighs on me tremendously because early on I began to use intravenous sodium ascorbate and saw that we helped these patients tremendously. I would see Kaposi sarcomas fading away, and so forth, and yet the thing is the insurance companies wouldn't pay for it. They couldn't pay for it, and pretty soon I was going broke giving this stuff away. And then when I finally had to stop it, a few patients that I sort of artificially kept alive for a year or so would die, and that was quite a burden. So anyway, for AIDS now, for instance, there's no question that if a person comes in with an acute attack of pneumocystis, that I will use intravenous ascorbate along with the Ceftibactam. You know, when AIDS patients get pneumocystis and are given Ceftibactam, that about 50% of them will break with a rash. Well, I think that's one of these phenomena that I'm talking about. The reason why that so many women can take Ceftibactam for just little bladder infections and not have any difficulties is that they're not that systemically ill. They don't have that many free radicals that are upregulating the immune system all over the place. But when you have PCP, you're really sick. You've upregulated the immune system tremendously, and so you have this an allergic reaction to Ceftibactam. If you saturate the person with ascorbate, either intravenously or orally, and really do neutralize 99% of the free radicals, you can give them the antibiotics and they will not have an allergic reaction to it. Now, you know, every once in 1 out of 100 cases will not have taken enough ascorbate to neutralize enough free radicals, so they will have a reaction anyway. In that case, I would definitely supplement them with more intravenous ascorbate. So this is one of the very valuable things. The other thing is that in the treatment of bacterial diseases, the ascorbate seems to work synergistically with antibiotics and seems to broaden the spectrum of antibiotics. And this is not just a casual matter right now, is I'm hardly away from the first and second generation of antibiotics, and I haven't seen a staphylococcus that doesn't respond to a combination of ascorbate and like Vicillin K or erythromycin. Usually if it's staphylococcus, I will use Keflex, but I don't really go on into these fourth and fifth generation antibiotics. I just haven't found that they're necessary. And so maybe because I don't practice in a hospital, I haven't seen the real bad ones, but I would imagine I would have gotten some resistant forms. And it does seem that ascorbate tremendously increases the spectrum of activity. The treatment of autoimmune diseases. Sometimes we really do help people with various autoimmune diseases. And I think my model in my mind is that something happens in the patient, that they get one of these indwelling infections of some sort or another, maybe cell wall deficient bacteria, maybe candida, whatever, which activates the immune system either against the organism itself or to certain foods and chemicals that they're taking into the body, and that if the antibodies, those particular antibodies, cross-react with different organs of the body, they cause trouble. I mean, very commonly, it causes like hypothyroidism, or it can cause diseases like endometriosis. That was one that was really mysterious to me until I read this article about how they had tapped the abdomen of normal women during their periods and found that there were endometrial cells in just about everybody, and that what's abnormal about endometriosis is not that the endometrial cells have backed up through the fallopian tubes. What's abnormal is that they implant in the peritoneal wall and that the immune system doesn't reject them right away, so that a weakness of the immune system will cause endometriosis, and that explains why the anti-yeast program will very commonly get rid of endometriosis. But then if the cross-reaction is with something like arterioles, then you'll develop something like lupus, or with the synovial lining, you'll develop something like rheumatoid arthritis. And if you can discover what the person is allergic to and suppress their immune system enough with ascorbate, you can turn it off. And like an acute attack of rheumatoid arthritis, there's no question that I can turn it off with intravenous ascorbate, and I mean very rapidly. It's like giving a huge cortisone shot, but you can't keep that up forever. And so that what we hope is that the entire program, which includes the anti-yeast diet, no sugars, zinc, manganese, chromium, selenium, B vitamins, and vitamin A and vitamin E, and whatever else seems to be appropriate, that with our entire program, that we get a certain percentage of remissions. And it's certainly better to try that first before methotrexate. I'm not saying that it works on everybody, but it certainly does work in at least 50%, and so we always push that. And I would imagine that with this oxidative therapy that we can kill off even more gremlins and be able to cure a lot more. I don't have experience in that right now, but that's been what I've been gathering from this group here. One of the reasons why I don't do very many blood analysis for food allergies is because I found people, when this syndrome starts in them, that their immune system is upregulated and they have antibodies to just about everything. And you get all these false positives. What I'm interested in is the antibodies that have built up and are cross-reacting. And if someday somebody comes up with a test that says you're allergic, you have antibodies to wheat and they are cross-reacting with the joint lining, you better believe I'll be ordering that all the time. But the problem is that I'll test for 150 foods and get 120 back positive, and I'm trying to take them off of sugar, and the ones that clinically obviously they're having trouble with, and of course you know that not all food sensitivities are allergic reactions at all. Like, for instance, the nightshades, tomatoes, potatoes, eggplant, red, green pepper, paprika, tobacco, are not allergies. They're toxic reactions to solanine, is poison that's in it that some people can't digest. And so that means that you could be reacting to nightshades without having antibodies to nightshades. So anyway, this is why I use the elimination diet almost exclusively on food and chemical sensitivities. So let's see. Now, as far as complications, the real complication that we have is that ascorbic acid can erode the enamel of teeth if the enamel is soft. And so I do keep them off the powder after. It's not going to erode it away right away, but if they keep taking it for years, it will. And so that's why I like to convert people over to the tablets and the capsules. The other thing is that after a long time, I find that many of the people who have multiple chemical sensitivities will become allergic to the ascorbic acid tablets, or excuse me, powder, but not the tablets. Well, that didn't make sense because the tablets are made from the powder. And I finally figured out it's the outgassing of gas from the plastic bottle onto the huge surface area of the powder that was causing the allergic reaction, that the surface area of the tablets and the capsules weren't large enough so that they weren't allergic to the tablets and the capsule. People who are frankly allergic to corn very rarely, but they do sometimes, but rarely seem to have trouble with ascorbic acid from the point of view of the corn. It happens, but it's very rare. Sometimes the chemicals within certain brands will cause troubles, and so this is one of the reasons why we use the Sago Palm sometimes. It's interesting that when Sago Palm first came out, that it was in a glass bottle, and even now it's in a harder plastic bottle than the usual ascorbic acid, and so there's less outgassing. Of course, we get gas and diarrhea. If the person has gas, look for food sensitivities, improper digestion, give them enzymes and acidophilus and treat candida, and sometimes, and if you treat them for other things, remember, the patient doesn't make gas, it's their bowel flora that makes gas mostly. And so that I look upon the gas that's increased with ascorbate as being caused by something else, and we can usually get rid of it. There's also this phenomena that a little ascorbate causes a little gas, moderate amount, large amount of gas, huge amount, no gas. When you have a person with a cold and they take 100 grams of ascorbic acid, usually what happens is the gas shuts down. They practically get to the point where they may have a little bit of diarrhea, but the stools are almost odorless. Is that I think that the massive doses of ascorbate finally will alter the bowel flora, kill off most of the bowel flora. I had a fellow up at Incline who had the job of culturing the water going into the lake and the sewage plants and so forth. He took a liter of water and put a drop of the water going into the sewage plant into the water, and then a gram of ascorbic acid, and cultured it every 15 minutes, and in 2 hours it was sterile. And so I don't worry about the sterility of these sodium ascorbate solutions that I have. Let's see. Kidney stones, never see a kidney stone. And this latest thing of Victor Herbert on iron difficulties, he says now that 10% of the people in this country have trouble with iron, and that ascorbate will cause hemochromatosis or something, I don't know. And I figure I put 22,000 people on massive doses of ascorbate and haven't seen a problem with iron yet. I do not, I mean, it's like pulling teeth getting me to supplement with iron. I see anemic patients, and they have got to have a very, very low MCV before I'll give them iron. And I find all the anemias that I see are caused by B12 folic acid deficiencies and multiple B, so we do use a lot of triple B shots. But they're anemic before the ascorbate. I have never seen a person get anemic who wasn't anemic before on the ascorbate. So Victor Herbert and his B12, that's a bunch of nonsense too. And has anybody here had trouble with G6PD deficiency? I've had the report of one case. Yes. One case. What happened?
He was a black man who had pneumonia, and I was giving large doses of ascorbic acid intravenously, and he started to develop anemia to the point that he required transfusion. But when I stopped the ascorbic acid, he did not develop any further anemia.
Yeah. Well, I mean, I have, you know, a few black patients. I have a lot of Jewish patients, and I have a fair number of Oriental patients, and somebody should have had G6PD deficiency.
I've been practicing almost 35 years. I've only
Yeah,
had one.
yeah. So, anyway, do you have any more time, or is that it?
How much more do you need?
Oh, I don't know. I'm through with the talk, so I wondered if there were questions.
I got one question.
Yes.
How long does your stock bottle last on your refrigeration?
Well, it lasts a lot longer. It lasts for a couple, 3 weeks now, since we've stopped mixing it up. See, this is a really neat maneuver. It turns out, I learned this from Sherry Lewin's book, that the more concentrated ascorbate is, the more stable it is in solution. And so that's why I leave it in this sledge in the bottom of the bottle. Now, after we swirl it, it maybe hit a slight yellow tint. When it begins to border getting a little bit almost orange, we throw it away. Yes.
High doses of vitamin C resulting in hydrogen peroxide production. What's there for that?
I don't know. I asked Dr. Farr, but the thing is with some of these, for instance, one of the things that may be happening is the energy made by the mitochondria in the form of NADPH goes down through glutathione to refuel the ascorbate. Well, all those reactions have double arrows, and so that it may be that massive ascorbic acid will force the reactions in the opposite direction. I don't know if it goes up as far as NADPH, but I would bet it has an NADPH sparing effect, and NADPH is what breaks up molecular oxygen to make superoxide and then peroxide. So maybe it works by that. By the way, one of the things that they didn't mention, but Sherry Lewin book makes a big deal out of, is that ascorbate seems to preserve and help the manufacture of cyclic AMP and cyclic GMP. And so I would imagine that peroxide does the same thing. And so this opens up Pandora's box, because cyclic AMP is helpful in all the hormones of the body. So here's another mechanism that the oxidative therapy people probably are helping out a lot. I think I'm going over time.
This would be a question you can think about, or maybe some of the other participants can think about it, because I have no solution. But a patient with light chain disease, and looking at all the literature and the latest textbooks, I can't find anything that's going to help me help him at all, and regular medicine hasn't. And so if anybody knows anything about the sulfhydryl bonds and that breaking off of that light chain, and maybe what could intervene or what could have caused it, is the light chain just a floating part that's been broken?
I think so. I have
an over-manufacture of that light chain.
Yeah, I have one patient who has that, and I've been seeing him for about 6 years, and he goes on, and he just has a little numbness and tingling of the toes, but we seem to have arrested the disease temporarily, and he hasn't developed cancer yet.
With vitamin C therapy?
Yes, and the whole nutritional thing.